Okay, so aorta, I mean the branches of aorta or arch of aorta you already know. So the branch of arch of aorta, okay, so common carotid, subclavian, common carotid, those you have to know, you already know. So subclavian arms, common carotid, vertebral arteries, the brain, we're done. The brain has branches, 3 of them are extremely important. Can't do without them. Remember, number 1 cause of death, any issue with brain, is stroke. So what's the most important disease of the brain? Stroke. It's not Alzheimer's, it's not Parkinson's, it's not infection, meningitis, or encephalitis, none of that, it's stroke. So therefore you have to know those blood vessels 3, middle cerebral, anterior cerebral, posterior cerebral, pica and ica. 5. I know it sounds like it's less, but it is a lot still, it's less. Yeah.
Posterior comes from
vertebral?
Technically from subclavian. Like, I mean, all the way through, like, if you go track back, like, vertebral comes from.
See, the
from
2
base,
vertebral
like,
joint become
or,
basilar.
Yeah.
So yeah, you could say.
All if you branch all the way back.
Yeah.
Because it comes right.
Exactly.
I'm just making sure.
Yeah, make it sure you come all the way from Adam. Remember, yeah. So that kind of yeah. So it depends how far you want to go. Yeah. Okay. Now, if you don't believe that, just delete what I said. I have to be careful because I don't want to offend anybody. They might not believe certain things. Okay. So need to know branches, blood vessels that supply the brain. Middle cerebral, anterior, posterior cerebral. Done. Done. Nothing else in the brain itself. Within the brain, you don't have to worry about anything. Brain's done, 2 of them, pica and ica, and done. Okay. Now at this point, you're not going to worry about symptoms of it. So I have to tell you the questions that I'm going to ask you on those is, this area of the brain is not receiving blood. What are is most likely blocked? And I'm not going to tell you the symptoms because it's not neurology. Does it make sense? I don't want to overwhelm you with extra information that you can learn in neurology regardless. Good? All right. But although I think I did talk about middle cerebral anterior, right? So right arm, left arm, right, left leg, left leg. Those are very basic. Good. Language or recognition, right? Okay, good. Pica and ica, if they are blocked, think of cerebellum. Cerebellum. Now, cerebellum is responsible for coordination and balance. This is something, 2 words. I think you can memorize that. Cerebellum, not cerebrum, cerebellum, the tiny little tennis ball brain behind your neck. It was responsible for many functions, but 2 of them are important. Coordination and balance. Voluntary balance. Voluntary coordination. What do I mean by coordination? So if I were to say to Rama, "Hi Rama, how are you?" I wouldn't be just like this. I'll go like this. Hi Rama. Can coordinate. No smooth movement. I'd say, "Hi Rama." No, nothing like that. It would be like breakdance. So no coordination. And then when I walk, imbalance. Voluntary balance. There's 2 types of balance. Sensory balance. You sense your ground, your space, your position in space. So when you close your eyes, you will know where you are. But voluntary balance is regardless, you will have it. Even though like, okay, the ground is this high or this low, you will still have imbalance. Like when you close your eyes or when you walk in dark, you have slight imbalance. You don't know how deep the ground is. So be careful. That's sensory imbalance. More imbalance is you completely aware you can't do anything about it. Okay, so sensory, you can fix it if you're able to see or if you're able to sense. Okay, so for pica and ica, please write it down. For pica and ica, if they are blocked, think of cerebellum, coordination, and very good balance. I didn't hear you guys, whatever you said. Ataxia, exactly. Now, brainstem is made of pons, medulla, and midbrain. There you have cranial nerve nuclei, cranial nerves. 12 cranial nerves. You know what? I'm going to do this right now. Forget it. because 12 cranial nerves are important, okay? Please remember that, 12 cranial nerves. Let's start with number 1 is olfactory for smelling, good scent and things like that. Okay, so, and let's ignore that. I'm not going to worry about that one. Okay, number 2 is optic. Optic. Optic is for vision, seeing. Optic nerve. Maybe I should write it down. Let me just write it down so kind of slow me down. Optic nerve is for seeing, vision. Okay, optic nerve for vision. You guys can see that, right? Optic nerve is for vision. So this is cranial nerve number 2. And I'll put here number 2. 1 is olfactory, and ignore it. You're never going to get tested on it. For smell purposes, for now, because the neurology will cover it. Number 3, oculomotor. Oculomotor nerve. And let's do number 4 because they are similar. What's number 4? Does anybody know? Starts with a T. Trochlear. Someone said trochlear. That's fine too. And let's ignore 5. I want to bring 6 because it's same, and I'll go next to 5. Okay, so just number 6 is abducent. Okay. 2 is for vision. 3, 4, and 6 are for eye movement. Eye movement. Eye movement. Eye movement. 3, 4, and 6. 6, if you want to know, I don't need to know it right now because it moves the eyes away from your body, laterally. Okay. 6, abducent, abduction, away from the body. When I'm looking towards my right eye is moving away from the center of my body or nose, that's abduction. But the left eye is moving medially, that's adduction. 3 does adduction, abducent does abduction. That's good enough. 3, adduction, moves the eye towards the center of your body or the nose. Medial movement is oculomotor. Medial, oculomotor. Lateral, abducent. Okay, so that's the movement. So all of these guys, 3, 4, and 6 are for eye movement. And you should know their name. Number 5 is known as trigeminal. Trigeminal nerve. Trigeminal nerve is responsible for sensing the skin of your face, feelings on your face. So, sensation, facial sensation. Touch is a sense. Temperature is a sense. Pressure is a sense. These senses are sensed by who? Trigeminal nerve. So trigeminal nerve is sensory nerve. Okay? So touch, temperature, and pressure, or anything like that. Good? Hot, cold, and so forth. That's trigeminal. But trigeminal is known as trigeminal because it has 3 major branches. Ophthalmic, maxillary, so it comes like this. Let me be a gangster for a while. 3 branches. I can't be naturally. I'm a good person. So abducent. So this is the trigeminal nerve. It splits into 3 branches: ophthalmic, maxillary, mandibular. Good. So jaw and below the lower lip, all of this is mandibular. From here to the eyebrow is maxillary, and then forehead is ophthalmic. 3 branches. That's why it's known as trigeminal. Good. All right. Now, trigeminal has one more function. That's something unique. It's not sensory. Closing of your jaw. Chewing. Chewing. Chewing is trigeminal. Chewing. Please write it down. Chewing. When you chew food, gum, viruses, bacteria, whatever you want to do. It's trigeminal. Let's do number 7. Number 7 is known as facial. Facial nerve. Now, facial nerve is completely opposite of trigeminal. What is trigeminal? Sensory. And the opposite of sensory is motor. Facial is 100% motor. A little bit taste as well, but that's special sensory. So, facial expression. Facial expression. So it's responsible for facial expression. When you look up and then you open your eyes, look, what is that? That's facial. And if you don't like the question, you look, then that's facial. When you smile, that's facial. I mean, that's the good part of it. Smiling is the best thing. Okay? When you whistle, when you frown, all facial expression is facial nerve. What number is it?
7.
Number 7. Everybody likes 7. Okay. One more thing. It has, now chewing was for the trigeminal, so it has one more thing. Taste. It's also responsible for taste. Facial nerve gives you a branch that supplies the tongue, the anterior 2/3. If you take your tongue and divide it into 3 sections, the front from here, from the tip, going backward, 2 areas. So if this is the tongue, divide into 3. 1, 2, 3. So this area is all supplied by facial nerve. So taste to the anterior 2/3 of tongue is by who? Facial. Now facial nerve, guess what, guys? Maybe this will, you don't have to know it. Facial nerve comes from your pons, okay, the junction of pons and medulla, through your internal acoustic meatus or ear canal, and comes and supplies the face. It comes out like that. So when you have pharyngitis, sore throat, sinusitis, sinuses, and there's congestion, and you are unable to taste food because that sore throat means your facial nerve, the branch, the lingual branch responsible for taste, is compressed. You can't taste anything. Okay, it's not, the virus doesn't take taste away from you, or the bacteria, like, okay, no, let me eat all the food, so he doesn't eat much. You know, their idea is so you eat more. They want you to eat more so they can get more nutrition, but by default, they cause this issue. Okay. Number 8 is known as vestibulocochlear. Vestibulocochlear, number 8. Number 8. Which is responsible? So, cochlear branch, cochlear. Does C sound like any type of music sound? Like, can you relate to C, cochlear? Cochlear means snail. Snail, it's round. But you know that the trumpet that is round, when you blow in it, it produces music. Cochlear, think of sound, hearing. Okay, so it's responsible for hearing. It gives you the ability to hear, listen, sound, sensing of sound. Vestibular branches for balance. So that's both hearing and balance. Hearing and balance. So number 8 has 2 functions. The vestibular part is for balance, balance, and the cochlear branch is for hearing. Number 9, glossopharyngeal. What does gloss mean? Not A, not glass with A, gloss with O. Tongue, very good. What does pharynx mean? Pharyngeal, so pharynx means throat. So this nerve must be supplying your tongue and throat, and it does. Glossopharyngeal, the posterior 1/3 for taste, and pharynx for gag reflex, cough reflex, and things like that. So glossopharyngeal. Okay? But you should know about glossopharyngeal, something else. We did that.
Carries
we did.
efferent.
Carries afferent.
Afferent.
Very good. Information.
From to the SA node, AV node, and
Not S node, AV node, no.
just the
Afferent means going to the brain.
brain.
Yeah. Don't forget.
From like
From aortic arch, no. Carotid, yes. Aortic is bivagus. From carotid bifurcation, baroreceptor, sinus receptor. Information from there is carried to medulla by who? Glossopharyngeal. So it also senses blood pressure. Glossopharyngeal senses blood pressure, and it makes you respond to it. You know, when you open the door in the morning, you want to sense temperature outside to see if it's cold or hot. And then in response to that, you're going to put a jacket or no jacket. Glossopharyngeal senses blood pressure. If blood pressure, I'm being like those poets. If the blood pressure is low, then it will cause heart rate to increase in response to that. But anyhow, so what do you need to know? Glossopharyngeal gag reflex. It senses that. It senses something in your throat. It doesn't cause gag reflex. Who causes it? Vagus. So the next one is 10, vagus. Vagus nerve causes the gag reflex, the cough reflex, but glossopharyngeal senses it. And vagus is, of course, all of you guys know about it. How could you not know? It's the most important parasympathetic supply to your body. Right? Number 11 is known as accessory nerve. Sometimes it's even called accessory spinal nerve, because part of it comes from spinal cord. And this is responsible for turning your head left and right. So if you want to look left, right, turning your head. That's accessory nerve. Number 12, hypoglossal nerve. It supplies the tongue, not for taste, movement, tongue movement. So it helps you swallow, move food around, tongue movement. I think there was mnemonic, somebody had it, I don't know. There's a song about it too.
There is, I just forgot.
Yeah. Okay, are we good? Now this is the important part when it comes to anatomy. Oculomotor, trochlear, and trigeminal. Uh-oh, never mind. Don't do that, don't do that. Do only two. Let's go from this side. So hypoglossal, accessory vagus, glossopharyngeal. All of these guys come from medulla. Their origins medulla. Now you can highlight. Their origins medulla. Okay. Next one, vestibulocochlear, facial, trigeminal, and abducent. They come from where? What's the next structure above medulla? Pons, excellent. So the idea is the smaller the number, the higher up it is, the nerve. The smaller the number, higher up, meaning it comes from somewhere deep in the brain. The greater the number, the lower it is. Okay? Two nerves. Trochlear. Whoa, that's ugly color. Trochlear and oculomotor, they come from midbrain. Good? Midbrain. Midbrain. Optic and olfactory comes from nowhere. They're within the brain itself. They don't come from brainstem. So this is known as brainstem. Brainstem is made of three structures: medulla, pons, and midbrain. That's brainstem. 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 Please memorize it. It's okay for now because this will be on the exam. Brainstem is made of three structures. Three structures going up, starting with medulla. Next is a round structure, pons. Third is midbrain. It's almost like eating ice cream. You know, like if you've seen ice cream, this is how they should be. So you have medulla, the cone part of it, and then you have the cone dilates. The cone will dilate. So that's the pons. And then you should have midbrain. I don't know what kind of ice cream is that. Definitely looks Caribbean because everything is colorful there. Yeah.
The 3 and 4 come from what? Brainstem? The brain?
3 and 4 come from midbrain. Midbrain.
And then 1 and 2.
Let's do this. It was blue, right? Okay. You know what? Let's do this so you can correlate. Yellow is pons. Green is medulla. Good? Now maybe it will make sense. So 2, the blue structure comes from who? Midbrain. Midbrain. This is midbrain. 3 and 4. 3 and 4. 3 and 4. Their origin is midbrain. Midbrain. MD. Woohoo. Good for you. Midbrain. Midbrain. The day you become midbrain, you'll be successful. Okay. 5, 6, 7, 8 actually comes from the junction. They come from pons. Yellow is pons. Okay. 9, 10, 11, 12 comes from medulla. Now, those of you who watch sports, you know, where you have more players than 5. We're not talking about hockey or basketball. I'm talking about maybe soccer or football. The rule in soccer is the most famous setting is 4-4-2. 4-4-2. So hopefully that helps if you want to relate it that way. Okay, 4-4-2 is the most important formation, not information. Okay, so 4-4-2. 4 from medulla, 4 from pons, 2 from midbrain. Good? The origin. So now, you know that pica and ica supplies these areas. So obviously, you should know them. Okay, so pica and ica supplies these structures. But behind them is the cerebellum. Okay, so pica and ica supplies the brainstem. All you need to write down, pica and ica supplies the brainstem. Pica, the artery, remember posterior, inferior, cerebellar artery, supplies the brainstem and cerebellum. If once we go to neurology, you will see, this is what you will see. Maybe sometime students cannot relate unless you have a good picture. Let me delete this part. So if you've seen a brain look something like that, and then you have this area in the bottom, midbrain, pons, medulla, and then spinal cord. This is what the brain should look like, although in this case the spinal cord is longer, but it's okay. Behind them, you should have a structure that's like this, with folds. That's cerebellum. Green is cerebellum. Green is cerebellum. Okay, so green is cerebellum. This is very basic information. Green is cerebellum. This area is midbrain. And this area is pons. This area is medulla. Okay? Medulla. And then you should have pons. Midbrain. They're not 100% separate anatomically, but you can recognize them. It's continuation of the same thing. If you have a cable, bunch of wires together, in one area it's dilated, one area it's narrow, you just call it different, like cord, and then the socket and whatever, you know, in that sense. It's the same fibers. Nothing should change. Nervous system, spinal cord, and brainstem is what? It's bunch of cables and wires connecting your body to the brain. Brainstem and spinal cord is bundle of fibers or axons or cables, if that makes sense to you, connecting the brain and the body. There's nothing else to it. It's not that complicated. What is complicated is what it does and where each fiber is located. But in short, it's bunch of wires, which is axons, correct? They're bundled together in a single cable. This cable spreads all over the brain. Some wires go here, some here, some here, some here, some here. So don't think about it too much. It's not that complicated. But in this area, we call it midbrain. In the green area, this area is called pons, and below that's called medulla, and below that's called spinal cord. And the spinal cord will eventually become individual nerves, right? It'll give you nerves. Okay, so that's all there is to it. They're all cables and wires carrying information, electricity, impulses, whatever you want to call it, action potential. Makes no difference. So now our goal is, since we're doing blood vessels, well, what artery supplies these structures? Okay, and that's your job. You want to know what supplies these areas. So if it's blocked, if there's a stroke, you should be able to identify them. That, you know what, this is caused by this artery. So the basilar artery, let me use red, unfortunately. The basilar artery goes behind, or in front of the pons, sorry. So, and then it will give you posterior cerebral artery going there. It will give you branches. This branches goes, for example, pica anterior supplies the pons, gives a branch here, and some branch here. Pica, most posterior, so mostly supplies the cerebellum. It just branches. As long as you know, for now, ICA and pica supplies 4 structures. 4 structures. Cerebellum, midbrain, pons, and medulla. Done. But guess what? There's an additional info that should give you a headache. Pons, medulla, and midbrain, all together, these 3 structures, red, green, and yellow, they're known as brain stem. All 3 together, they're just known as brain stem. If you're not happy with this name, maybe you should come with a different name and then see if they accept it. But for now, it's brain stem. 3 structures. They're known as brain stem. Pons, medulla, and midbrain, period. So brain stem connects spinal cord and brain. It's the base of the brain. It connects 2 structures, brain itself and spinal cord. Good? So, I didn't want to do that. Now you should know that blood vessels of the brain are anterior, middle, posterior cerebral arteries, only supplying the brain itself, the brain, cerebrum. But then we have 2 additional arteries, which comes from basilar, not for vertebral or internal carotid, from basilar itself. And those are ICA and pica for short. Posterior inferior cerebellar artery, anterior inferior cerebellar artery, not cerebral, cerebellar. These 2 arteries supplies brainstem and cerebellum. The name is always telling you cerebellum. Inferior cerebellum, either posterior or anterior, right? Okay, good. So we're done with brain. Don't think about it no more. That's all you need to know. You know the function of cerebellum, you know the function of medulla, you know the function of pons, and midbrain. What do you know about them? What do you know about midbrain? What's the function of midbrain? Because I just said you know it. Excellent. Thank you for not making me a liar. So you do know. Good job. Yes. 3 and 4 cranial nerve come from where? Midbrain. If there's stroke of midbrain, what do you expect? Paresis, paralysis, or whatever it results from the stroke would be only those 2 cranial nerves. So obviously 3 and 4 are for eye movement. Eye movement. So what would you expect? Double vision. Double vision. Not lack of vision.
Either one, if either one's damaged.
Yeah. Remember that, guys. I didn't say blindness or visual defect. Double vision is different. You just see double. So, because it's responsible for eye movement. Again, if you don't believe me, just take your finger, put in the bottom. Those of you who have done it before, you should be able to do it with ease. And push your eyeball. And see how many do you see. You see double. Even triple something. But double vision. Eye movement, abnormal eye movement will give you double vision. The two eyes have to be working together. If they're not, then you will see double vision. Okay, so 3 and 4, midbrain lesions or stroke gives you double vision. And let's not think about it more for now. That's good enough. Okay. How about pons? What nerve comes from pons?
5, 6, 7, 8.
Very good. 5, 6, 7, 8. So now you have facial expression problem, you have facial touch problems, and you have double vision from 6. Okay, so these are the kind of things you should be looking for when you have a stroke of midbrain. In medulla there's additional. Medulla can cause death because you have the cardiorespiratory center in medulla in pons. Cardiorespiratory center, breathing and heart rate are controlled by medulla. So from medulla, the important one is number 12, tongue movement. Okay, so from medulla, tongue movement. And maybe some balance, number 8. 10 and 9, I wouldn't worry about. Gag, cough, reflex, sure. Anyways, we're done. So you know now what to expect. Subclavian supplies your two arms. So you will have decreased pulse, maybe, tingling and numbness, or immobility in that arm. Okay, so we're done with those guys. Now, let's move on to branches of, very good. So there's some branches of thoracic aorta. Look, we just talked about arch of aorta, branches of arch of aorta. Oh my God. Let's talk about descending aorta. What are the two important, the most important branches of ascending aorta? Coronary arteries. Coronary arteries. Very good. Yeah, ascending. Yeah. Ascending aorta. The beginning of aorta. Are two coronary arteries coming from the aortic valve, correct? So that's where we should start. And then arch of aorta is these three. Common carotid, left subclavian, and brachiocephalic. Good? So we're done with these. Let's move on to thoracic aorta or descending aorta. Thoracic aorta or descending aorta. So it'll be right here, this area in green. Thoracic aorta and or descending aorta, which I call it in green. But you know what? Thoracic aorta, they give us too many branches, so we're not going to worry about it. The branches are intercostal and bronchial. Let's just ignore it for now, because I don't want to give you like thousands of blood vessels. You know, that's not the idea. Unless you become vascular surgeon, you will learn them. But for now, it's okay. Basic things. Let's move on beyond the diaphragm. So the diaphragm, below the diaphragm, aorta is called abdominal aorta. Abdominal aorta. So this will be the diaphragm. Okay. Below the diaphragm, aorta becomes abdominal aorta. Abdominal aorta has some very important branches. Now, those you should know. Okay. Those you have to know. One of the first branch, okay, is renal arteries. Left and right renal artery. They're big, big branches. Renal arteries. Renal arteries. An artery that supplies the kidney. Left and right renal arteries. Okay? That's all. That's all you need to know, because we'll discuss the rest in the kidney section. As long as you know renal arteries are branches of abdominal aorta. Where do they supply? Kidneys, left kidney, right kidney. Okay? So if they're blocked, what do you expect? Renal problems. Simple. Keep it simple. Slightly above that, there's a branch known as celiac trunk. Celiac trunk. Celiac trunk. Okay, so celiac trunk. Celiac trunk is one of many important abdominal arteries, celiac trunk. So I'm going to erase the name because I'll just keep it. So this one is renal. renal artery. Okay, so celiac trunk. Now celiac trunk supplies foregut. Just write down foregut. Foregut. F-O-R-E and then gut. Foregut. Celiac trunk supplies what? Foregut. Foregut. Although foregut doesn't exist in adults, it's only in fetuses, but it makes life easier. So whatever structure comes from foregut are supplied by celiac trunk. Some of the most important ones, let's do this. Liver, spleen, pancreas, stomach, esophagus, so celiac trunk supplies stomach, liver, spleen, pancreas, esophagus. If it supplies the liver, it should also supply what else? Something that's right under the liver. Gallbladder. Very good. If you don't say gall, it says just bladder. What do you think? What does that mean? Okay. Dark, bile storing. Okay. So these are the structures supplied by celiac trunk. You don't need to know anything more. We'll cover the rest in GI. Basic. Stomach, liver, gallbladder, spleen, pancreas, esophagus, and add one more, duodenum. But duodenum, the first two parts. I'll just put second part, up to second part. The first part and second part. Okay, but that's good enough for now. So proximal duodenum, the beginning of duodenum, stomach, gallbladder, spleen, pancreas, all of this. This is supplied by who? Celiac trunk. Celiac trunk. Good? Can you remember that? Don't go more into detail for now. That's all you need to know. You see where the renal arteries are? Just slightly below, in between, there's another branch coming. This is known as superior mesenteric artery. Mesentery means inside of abdomen. So superior mesenteric artery. Superior mesenteric artery. Okay, superior mesenteric artery takes on where celiac trunk left. So which means it still supplies duodenum, but distal duodenum. Duodenum is divided into 4 parts. 1, 2, 3, 4. So third and fourth part. I'll just say distal. Distal duodenum. What does distal and proximal mean? From its origin, right? Good. So distal duodenum, superior mesenteric, it supplies from there all the way to transverse colon. So after duodenum, what's the next structure in the abdomen? You guys must have had surgery because you skipped a lot of intestine. Jejunum. Ileum. Descending colon. There you go, that's better. Thank you. Ascending. And then transverse colon. Colon. But transverse colon, distal to third. Only up to 2/3. Just that's good enough. Now, what's the beginning of ascending colon? Cecum. So let's say that, cecum. What's attached to cecum like a tiny little finger? Appendix. Okay? So that's superior mesenteric artery supplying only intestine. Only intestine. That's known as midgut. This is known as midgut. All the structure of midgut. Celiac trunk, foregut. Superior mesenteric, midgut. Inferior mesenteric supplies hindgut or hindgut. So let's duodenum is correct, jejunum is correct, ileum is correct, ascending colon is correct, transverse colon 2/3, cecum and appendix, all of these are correct. Now terminal ileum is supplied by who? Superior mesenteric. So people who, and this is the most common one that goes through stroke. The most common abdominal artery that involves stroke or thrombosis is superior mesenteric. Superior mesenteric. Okay, superior mesenteric. And that's known as mesenteric ischemia. Okay, so there you go. There's another branch coming below superior mesenteric that should be known as inferior mesenteric artery. Inferior mesenteric artery. And it supplies the rest of the intestine. So this is distal T transverse colon. That's one. And then after transverse colon you have descending. Descending colon. After descending colon, what do you have? Sigmoid colon, Bashir, good job. Does that sound like the hemoglobin curve? Yeah, sigmoid colon. It's S-shaped, that's why it's called sigmoid. Then it's what? Rectum. And anal canal. Now, anal canal has two parts. Let's ignore it. Okay. The external is by pudendal artery, and then the internal one is by superior inferior mesenteric. So there you go. Abdominal arteries, 3 huge arteries. Celiac trunk, superior mesenteric, inferior mesenteric. Okay, so you know what structure they supply, and that's a lot of memorization, but know it. You know what? If you get confused, think of, let's see if we can make it easy. Think of exactly what happened during embryogenesis or fetal development. During fetal development, the entire intestine was a single tube. When the fetus started developing, all of us, when we were in that dark area with some fluid and were swimming and we couldn't think and our eyes were not developed, your gut was a single tube. Mine too. Single tube. Okay? Now, the beginning part, the first part, going from top to bottom. So it's divided into 3 sections. This tube was divided into 3 sections. Green, blue, and red. For us, it's colorful, but anatomically it's divided into 3 areas. The green part, so it's 1, 2, 3. The green part is known as foregut. Blue is midgut. Red is hindgut or hindgut. Okay? So it's a single tube. Let's start with this, guys. From esophagus, what's the next structure? Let's keep going. When you eat food, okay, let's say you just swallow a whole cherry. This cherry will go through esophagus first, correct? Then where does it go? Stomach. Then where does it go? You know, is it okay if I erase these? Because I think you guys wrote it down. I'll erase this part so I have some room. How long is your intestine? Very good. So it's long. Now, how big is your abdomen? So it has to fold. When things are folded, you can't really see who's the beginning, who's the end. They're all over the place, right? That's why it's difficult, but it's a single tube. Everything should be a single tube. Look. So esophagus, right? And then the stomach. That's what you said. After stomach, what is it? I should have used green. Should I just tell you? Very good. So stomach, duodenum, so esophagus, and then stomach, duodenum. There you go. And this is foregut. But from here, something comes, and that's known as liver. Liver grows from this area. Spleen grows from this area. Gallbladder grows from this area. Okay, so all the structures that come from foregut, they're known as foregut structure. And foregut has one artery, celiac trunk. So the thing that's difficult for you is probably stomach is easy, esophagus is easy, duodenum is easy. Pancreas, which is right here, should be located here. Let me change color. Pancreas should be located right here. This is pancreas. Pancreas, spleen, gallbladder, and liver. Those are difficult for you to understand because they're not directly part of the tube. They actually grow from the tube. So those you have to memorize. All of these are foregut. The rest is easy now. Let's move on to blue. Duodenum continues, correct? And then it becomes jejunum. And then it becomes ileum. And then ileum attaches to who? Cecum. And then cecum has a little finger or appendix. And the cecum will continue as ascending colon. And then this ascending colon becomes transverse colon. It becomes transverse colon. So transverse colon. All of this is, in blue, is midgut. It's a single tube. It's just folded. If you get confused, think about it that way. The order and the sequence of structures. The first third is celiac trunk. The middle part, 1/3, is superior mesenteric. The last 1/3, the end of this tube, is supplied by who? Inferior mesenteric. Divided into 3. So now, third part in red, so the distal part of transverse colon, ascending colon, okay, and then of course sigmoid colon. Oh, that's horrible. Sigmoid colon, and then rectum, and then anal canal. All of this is by who? Inferior mesenteric. Okay, so I don't think you will get confused, but just in case, just know it's a single tube. The first 1/3, celiac trunk. The middle 1/3, superior mesenteric. The last 1/3, inferior mesenteric artery. And you're okay. All right? So when you have, stroke or something like that, that's what you should be thinking. I mean, mesenteric infarction or ischemia, you should be thinking about these structures. As long as you know what structure is supplied by who. Let's take a break. We're almost done with abdomen, then we'll go to lower extremities.
Good morning.
Good morning.
Yeah, I did my notes. Some of my notes and I wanted to study that. Okay, I got it. What does this say?
Their job is so if the opposite goes and then they come along, they just want
Yeah. Okay. All right. Good.
Yes, exactly.